Welcome to Mansik Shakti Foundation. I am here to talk to you about our latest development, and I'm very happy to inform you that we have come up with a digital design, and this app is known as Relief. It's for students between the age of 18 to 30 years. The main purpose of this technology is to do a mental health screening and assessment. As you know, the problem of mental well-being, psychological stress, depression, addiction, and so on is gradually increasing in our student population. Not only in student population, though we have only 50% population going to universities, rest of the 50% are outside the universities. And both groups have equal problem. They have difficulty in accessing care. There are no special programs for them. Though government has created number of facilities, but people are not aware about it. For example, Telemanas or district mental health program where someone can go and seek care. When I was talking to number of academicians and teachers in various universities, what I came to know is that they feel helpless. They have told me that we do not know how to deal with the issue. Awareness is poor, stigma is very high, parents are afraid, teachers are unaware, and therefore the students suffer in silence. Just to tell you the number, about 10% of students at any point of time carry suicidal ideas in their head. About 20 to 22% students in university suffer from various kinds of depression. Similarly, about 30% have anxiety spells. About 2/3 suffer from stress problem, and about 1/3 of them complain of severe stress. 15,000 students every year, unfortunately, die due to suicide. And about 10 times of this number, they attempt suicide, they are treated well, and they are brought back to the community. They go back to the same school, same college, where situations have not changed. These students are expected to perform at the similar standard. They are again subjected to the same amount of pressures and stress, and they succumb again. Such is the condition of our universities. It's not only that in India alone we have problem of student mental health, student mental well-being. It's all over the globe. In India, it is about 24% on an average that students suffer a psychiatric disorder or a stress problem. Whereas in Europe, it is about 60 to 62%. In America, it's about 30 to 35%. So, because of our problem, it does not mean that numbers do not determine the nature of problem. Even if a single person is suffering, we got to be worried about it. It is the problem that during this age, when their brain is growing, when they are learning their skills, they become sad, hopeless, depressed, isolated, and they are then deprived of it. There are a number of reasons why students constitute a special population in our community, and we have to take care about them. One of the aspects of taking care is increasing the rate of access to care. We must provide facilities so that students by themselves get up and go for help and treated as early as possible. This was the single line philosophy that we started working in this field. The issue was, how do we do that? There are already counselors in every schools and universities, but the situation is not changing because the students do not open up. They do not confide. They do not talk to people. They have barriers. They feel ashamed because it is severe stigma, and stigma is deep-rooted in the community, in the society. At this point of time, we decided, and some of us psychiatrists got together to discuss what best can be done. And we thought of implementing three basic principles. First, if we can empower students that they can do things on their own, they can assess themselves, they can decide for themselves, they will be probably more motivated to go to a psychiatrist, a physician, a counselor, a doctor, or their loved one to talk to. We must believe that they can take a decision, and we have to simply facilitate the process of taking decision. The second aspect was that if we believe that they can do it, how can they do it? What are the methodologies? What is the process that they can employ? We went back to literature and remembered the entire practice of clinical psychiatry, and we know two things. One, psychometric evaluation has stood the test of time for screening and assessment. It's used in all the countries, including our country, by every clinician. We thought we would develop a comprehensive psychometric test which will represent not only a direction of single disease or disorder, but which will reflect a comprehensive vulnerability of a student which can be trusted. The second aspect was the method of self-assessment. Is that a valid method? Can an individual assess themselves by using the psychological test? The answer is yes. It has been persisting, it has been in practice since very long time. At this point of time, we thought of developing the test and giving it in the hands of students to evaluate themselves. We constructed 7 different types of tests. First was the severity of stress, and the second test was for the source of stress. The third was about whether there is any psychiatric warning, whether the student has any symptom for which he or she should consult a psychiatrist, a specialist as early as possible. And the fourth test was assessing the symptoms, whether someone has a problem of psychological illness. Next was assessing the risk. Then we came to assessment of mental strength, and we developed scales for resilience and level of function. Two together reflect overall mental attitude, mental functioning, mental strength, which is crucial in deciding whether an illness will develop, what will be the body's response to a stressful situation. Having developed this and testing this in a population of students, we decided to digitalize it. At this point of time, technology came in picture. We successfully developed a web-based app and a mobile app, which was configured for the test and for criteria and a set of decision-making tree or algorithm. Once the test is performed by a student, the data passes through the filter of criteria which decides what is normal and what is abnormal. The entire data set again passes through a decision-making tree or algorithm to determine three outcome measures. One, whether the student can do something for himself, self-development, lifestyle changes, exercise, stress relaxation, stress management, memory regulation, etc. Or he or she has a need to go and discuss with a counselor, or whether there is a pressing need to consult a psychiatrist. So from the data entry point to decision-making point, this app has all in one gadget very comprehensively. There are certain things very special about this instrument. First, it does not give any diagnosis. No one should mistake that it is an instrument which provides a diagnosis. None of the psychometric evaluations indicate any diagnosis. They only suggest the possibility of certain conditions. Second, it is not unilateral. That means we are not presuming that you have depression, so you do the test of depression, or you feel anxious, so you do the test for anxiety. No, It takes into account the entire psychological mindset, entire information which is required for filtering out a possibility for developing a mental health condition. And third, entire data set is disintegrated together and then reintegrated via algorithm. This is a unique item. This is a unique experiment, though it is a very small step in direction of developing digital mental health interventions. This instrument is not an interventional instrument. It does not provide any therapy. It only provides what decision is necessary, what decision is correct, how to help a student, how can they be more determined that I need a psychiatrist, I need to see a counselor, or I need to really work on myself.